right, well, good afternoon, and thank you very much for joining us for today's webinar. My name is Dr. Heather Gornick, and a few housekeeping notes before we begin our session. In this platform, all attendees are muted. While you won't be able to ask questions through your microphone, please note the Q&A function on your screen. If you have a question that is not addressed in the presentations, and we hope you have many questions because we'll have lots of time for questions, feel free to submit through the Q&A feature, and our presenters will try to address as many of your questions as possible at the end. Also, today's webinar is being recorded and will be posted on our UH website. As an attendee of today's session, you will receive an email with the link once it's live. It is now my pleasure to introduce my friends and colleagues and the presenters for today's session. Today, we're going to focus on vascular health during the COVID-19 pandemic, and I'm very pleased to introduce my esteemed colleagues. We have Dr. Vikram Kashyap, who's the co-director of the Vascular Center and chief of the Division of Vascular Surgery and Endovascular Therapies here at University Hospital's Harrington Heart and Vascular Institute. He's also the Alan H. Markowitz Master Clinician for Cardiovascular Surgery and a Professor of Surgery at Case Western Reserve University School of Medicine. Welcome, Dr. Kashyap.
Thank you.
Also with us today is my colleague, Dr. Mehdi Shishabor, who's co-director of the Vascular Center and director of the Interventional Cardiovascular Center at the University Hospital's Harrington Heart and Vascular Institute, and he is a professor of medicine at Case Western Reserve University School of Medicine. Welcome, Dr. Shishabor.
Thanks, Heather.
And finally, my colleague, Dr. Natalie Evans, who is the co-director of the Vascular Laboratories at the University Hospital's Harrington Heart and Vascular Institute and clinical assistant professor of medicine at Case Western Reserve University School of Medicine. Welcome, Dr. Evans.
Thank you, Heather.
Okay, so our agenda for the next hour or so is to review the impact of COVID-19 on routine vascular care, review the symptoms of peripheral vascular disease, warning signs, and when and how to get care. We're going to go over some tips for maintaining vascular health during COVID-19, and then we're going to have hopefully robust time for lots of questions and answers, and then we'll review some resources. So I will now turn it over to Dr. Kashyap, who's going to take us through the impact of COVID-19 on the care of patients with vascular disease.
Thank you so much, Dr. Gornick. It's a tremendous pleasure to join my esteemed colleagues in the Harrington Heart and Vascular Institute. And I want to start by saying that I think we're all in very challenging times. So thank you all for taking time out of your day to join us to learn about what's happening in our worlds, and also hopefully we can give back and provide you some information that may be helpful as we navigate the current pandemic. So on this slide, one of the interesting things about vascular disease is we're really taking care of problems from the base of the skull to the tip of the toe. So on your right are some cartoons showing carotid blockage, which can lead to stroke, AAA, which is abdominal aortic aneurysm, a bulge in an aorta that can lead to problems including hemorrhage and death, and a cartoon showing what plaque looks like in the lower right, which is accumulation of cholesterol and other factors that can block arteries. These can obviously block arteries in the coronary vessels, but also importantly in the leg arteries, in the arteries going to the carotid, to the brain, like I said before, to the kidney arteries and other locations. On your left is the coronavirus, which I'm sure all of you have seen this type of cartoon, which is on CNN, Fox, and almost every TV station. And I'm pointing this slide, I have an arrow in the middle of the slide to show you how this microscopic virus is just pushing everything else out of the way.
Mm.
So currently, as many of you know, our hospitals have stopped doing any kind of elective surgery. We've really held off on taking care of patients because of very important measures with distancing. We're trying to preserve resources. And these resources are the PPE that you've all heard about, personal protective equipment, ventilators for those patients in dire need with COVID-19. We're trying to preserve people. We want to avoid doctors, nurses, and staff from getting infected and preventing us from taking care of patients. We want to preserve hospital beds for the surge of COVID-19 patients. Well, good news, especially in Ohio. We've done a tremendous job of flattening the curve. And I think we have avoided that huge surge that we were worried about a month ago. And perhaps as we get back to normal, some of the vascular care, the routine vascular care, which has been put on hold, will come back. As most of you know, most of our doctor's visits are now virtual. So all of the panelists here are doing a lot of these type of events, which is Zoom or using Doxy.me or iPhones to connect with our patients. We're still performing very urgent and emergency surgeries, but not elective surgeries. But hopefully, as of tomorrow, we're going to start restoring some normalcy to our overall care in terms of doing elective outpatient procedures. Next slide, please. Just to give you a sense of our activity, these are all the patients that we took care of over the years from 2011 to 2019. And this shows the number of procedures in the operating room, the number of procedures in the catheterization lab. So these are both open surgical procedures and endovascular procedures that we were doing on a yearly basis. And in 2019, we did over 5,000 procedures, and we took care of a lot of patients. And this doesn't include the tens of thousands of patients that underwent testing, underwent visits in the outpatient area, had exams, etc. Next slide, please. But since the pandemic has started, and because of social distancing, because of hospital rules that we put in place, because of the halt in all elective procedures, you can see that the number of visits have dramatically fallen. The number of virtual visits has dramatically increased, and the testing and the other things that we do have also dramatically fallen. Next slide, please. But I want to reassure you that we're all here for you. Even though currently we're in a self-imposed social distancing, or I'd like to say physical distancing, all the members here in the Vascular Center, as you can see in the slide, are ready to take care of you. And as we get back to normalcy, and even before then, we can connect with you virtually, and we're definitely ready to see you directly when the time is right. So with that, I'll turn it over to my partners. Thank you.
Vic, thank you very much. Now I'm going to turn it over to Dr. Shishabor, who's going to review the important signs and symptoms of peripheral vascular disease.
Well, thank you very much, Heather, and thank you, Dr. Kashyap. It's really a pleasure again to be here this afternoon with you all. And I want to echo Dr. Kashyap's points. We appreciate you. We appreciate your time being here and learning about vascular disease and how to get attention during COVID-19 and even beyond that. So I would like to go over a few slides. Next slide, please. I am a cardiologist and trained as an interventional cardiologist. My passion is vascular, so I couldn't hold back and have at least one slide related to heart attack. As you know, we have been advocating for patients not to stay at home during the COVID pandemic. especially if they're experiencing chest pain or what appears to be a heart attack. So if you have any of these symptoms, I want to encourage you to please call 911. If you have chest pain, if you have shortness of breath, if you have chest pain radiating to the left arm, if you have evidence of chest pain with or without shortness of breath, any of these things at least should cause you to call 911. If you are very hesitant to call 911, there are numbers that are going to be provided to you during this presentation. You can call these numbers and get an urgent virtual visit and get your questions answered and at least get a professional opinion regarding some of the symptoms you may have. I'd like to make 2 quick points about this. There is a lot of overlap between the symptoms of heart attack and that of COVID-19, such as chest tightness or shortness of breath. So even if you may think that you're having COVID, it may actually be a cardiac problem. And it will be helpful to have a professional discuss it with you and resolve this and give you further advice. Next slide, please. Similarly, we don't want folks to be sitting at home if they're having a stroke. We have also seen a number of patients with a stroke who are coming late to the emergency room with signs and symptoms of a stroke. I think this mnemonic FAST is a good one to remember. I'm not going to go over all the details on the left side, but I think if you have any facial drooping, if you notice any weakness in your arms or your legs, if your speech is becoming slurred, this is the time to call 911. Please, I've had patients that have told me that they don't want to burden the ED because they want the EDs to be taking care of COVID-19 patients. As Dr. Kashyap mentioned, we did not get a surge. All of you guys, all of us did a great job of keeping the surge down. So our EDs are open, and all of the EDs, the facilities within UH have been designated in a way to not allow patients with COVID to get exposure to patients that don't have COVID, meaning that there are areas that are specific to protect patients that do not have COVID. Similarly, in the hospital, in the cath labs, in the procedure rooms, and in the ORs, we have made those kind of protections to protect not only the patients, you guys, but also to protect the healthcare workers. Next slide, please. And other vascular conditions to remember, some of you may be on blood thinners, be taking anticoagulation. If you are having bleeding problems related to these, please don't forget to seek help. Don't, just before this call, one of our colleagues reminded us that a patient was on Coumadin, for example, and many of you may be familiar with this medication, it's a blood thinner, and this person did not seek any advice or help for a few weeks without knowing what the level of the blood thinning was in their blood. We don't want that. That can be very dangerous. If you are feeling heaviness or fatigue in one of your legs or cramping, you may want to seek help. Now, that may be something that you may want to seek help virtually and not come to the emergency room if it's just something chronic versus something that happens suddenly.
Pardon me.
And then there is a number of other things that, maybe Dr. Gorning is telling me to go faster. I don't know.
Oh, no.
I tend to talk too much, so it's possible. But if you have other symptoms, such as, difficulty with walking, or if you have gangrene or a lack of blood flow to your foot, that's definitely something that you need to seek immediate help. So calling some of the numbers that are on these slide sets would be very helpful. Next slide, please. So a lot of you may know that I'm very passionate about limb salvage, one of my areas of interest. So as Dr. Kashyap and Dr. Gornig and others on this call are to save people's legs. Next slide, please, if you can just fill out the pictures, is to help these patients and people that you may know, or some of you may be having some of these symptoms that have ulcers in their foot. They may have gangrene. They may have sudden pain in their leg without blood flow. If you have any of these conditions, we highly recommend that you seek help. And we are available both virtually and in person. So if you feel that, you know what, I don't care what Dr. Shishibor says, I am not going to the ED, I'm not going to the hospital, that's fine. Today, I saw 12 patients virtually, and we can look at your wound, we can discuss it with you and make a decision together. Next slide, please. As Dr. Kashyap showed, with the COVID being here, we already know that many patients are not seeking help, that the focus has become on COVID because of fear, because of confusion, because our patients are altruistic, people like you, they're not trying to come to the EDs or seeking help in a hospital. We know that the number of patients not being treated are even increasing. This slide shows you, this is before COVID. If you look at the x-axis, is the number of, is the regions in the United States and the amount of vascular care that's being provided. On the y-axis is the number of amputations that have been performed without any evaluation in the year prior. So somebody undergoing a major leg amputation, but not getting any vascular evaluation in the year past. And regardless of what region in the country you're in, even in an area that is a lot of vascular care or area where there's little vascular care, between 32% to 70% of the patients that underwent a major amputation did not get an evaluation. So we are worried because this is what we're coming with. And with addition to COVID, we don't want this to even be worse. So we really need you to seek help and guidance if you're suffering from one of these conditions. And on my last slide, CLI or limb salvage, trying to prevent people from having amputation, is very important because it also encompasses a lot of conditions. So the kind of patients that I see and Dr. Kashyap sees are people that have diabetes, there are people that have vascular disease, there are people that are smokers, they have hypertension, they have coronary artery disease, the conditions that also puts them at risk of COVID. So it's also more important that, you know, we have a way of communicating. So again, please don't hesitate to reach out to us virtually, even if you don't want to come into the hospital because of fear, which is totally understandable, even though we are assuring you that we are safe and that we have designated areas for you. But if you still have fear, know that we are here for you virtually or in person to take care of you. And please don't stay at home with these kind of conditions that could be potentially dangerous. Thank you so much.
Thank you very much, Mehdi, for that very important message. Next, I'm going to turn it over to Dr. Evans, who's going to give us an overview of maintaining your vascular health during the pandemic.
Well, thank you so much, Dr. Gornick. And one of the disadvantages of virtual visits is sometimes technology fails us, and I was briefly kicked off the internet, and I want to make sure my colleagues can hear me.
Yes.
All right, very good. So I think one of the things that's really important to remember during this crisis while we're all sheltering at home is that continuing to take care of our other health issues is so important. And so a lot of vascular diseases are treated medically. And so it's really important to continue all of your medications as prescribed. In particular, as Dr. Shishabor mentioned, anticoagulants or blood thinners are incredibly important. So in patients who've had blood clots in the veins, deep vein thrombosis, or pulmonary embolism, or those with the abnormal heart rhythm, atrial fibrillation, or people with mechanical heart valves, they absolutely need to make sure they're continuing their anticoagulants. A lot of patients with coronary artery disease or peripheral artery disease have had stents put in, and so it's very important to continue their aspirin or clopidogrel, which is also known as Plavix. And aspirin, a lot of patients who've not had stents are required, really need to keep that going. And I think it's important, actually, Heather, if you could go back one slide. I think another important thing to remember is diabetes goes with a lot of vascular diseases and can make vascular disease worse. So another important one to continue. And if you're running low on medications, remember that sometimes it takes us some time to get that to you. So it's a good idea to get in touch with your doctor, usually a week before you're out of medications. Dr. Shishapur mentioned warfarin in particular, or Coumadin. This medication requires blood monitoring, and so this is really a safety issue. Patients need to continue their anticoagulation clinic visits. This is an essential health service. Unmonitored warfarin can increase the risk of either bleeding or clotting complications, and so we want you to be seen in person to get your blood checked. And our anticoagulation clinics are being very careful. Patients are being screened at the door. We're practicing social distancing in the offices to ensure your safety. I want to talk a little bit about chronic swelling disease, because I think this is a particular hazard of sheltering at home. So things like varicose veins, the post-thrombotic syndrome, which is chronic swelling in patients who've had deep vein thrombosis, things like lymphedema are always worse when we sit, and people who are sheltering at home may be more sedentary. And so it's really important to continue compression stockings, especially if you're going to be sitting for long periods with your legs down. And then I always like to tell patients the 3 keys to leg swelling are compression. So any kind of compression stocking or compression garment that you've been prescribed. Leg elevation, so some of us working from home, we're using laptops. If you can sit somewhere where you can prop your legs up, that's fantastic. And then activation, activating your calf muscle. So walking, increasing your walking can help with that leg swelling. Next slide. So exercise is incredibly important for vascular health, and you can continue to exercise even though gyms are closed during this pandemic. Outdoors exercise with proper social distancing is very safe, so you are unlikely to catch the virus when you're outdoors. It has, the virus has less of a shelf life outdoors. Walking exercise in particular is beneficial for nearly all vascular disease, and exercise has other benefits. So improves mood, helps with stress management, and may even have some long-term benefits for memory. Next slide, please. Other things you can do to stay healthy during the pandemic. So find a good balance between being active and resting. Eat a healthy diet and eat regularly. Manage stress, whether that's through things like artwork, writing letters, connecting with people, meditating, whatever works for you. We do want people to avoid going out in crowded situations. So if you do have to go out to the grocery store or the drugstore, wear a mask. Wash your hands properly. So that's 20 seconds, making sure you get all of the surfaces. Soap will kill the coronavirus, and make sure you cover your coughs and sneezes. I think it's really important that even though we may be isolated in our homes, that we don't isolate ourselves from each other. So call your family and friends, Skype or FaceTime if you can, write letters. And very important, as Dr. Shishapur mentioned, do not delay care. So particularly if you're having symptoms of heart attack and stroke, things like that, that's absolutely an important emergency department visit, but also stay in touch with your doctors. We are here for you. We can follow up via virtual visit or even a phone call if not in person. Next slide. So virtual visits. Some of you have probably experienced this already. Your care team can help you decide if it's something that works for you. The patient and physician can talk to each other, see each other, and even in some cases do some aspects of a physical examination. And it's a great way to keep your care up to date, even though you're staying home. If you do have a virtual visit, it's good to have a list of your medications or even your pill bottles to show us, and also a list of questions or concerns to discuss. If you don't have a computer or a smartphone, we can do a telephone visit. So that's also a possibility. Next slide. And the things you need for a virtual visit: an email account, some device with a camera, and a microphone. So a smartphone, an iPad, other kind of tablet, a laptop with a camera and microphone or a webcam. And then you need to have Wi-Fi. You can do a telephone connection on a smartphone, although your video may be a little slower. And if you want to do a virtual visit, you can just schedule with your doctor's office by phone. You'll get an email with the appointment date and time and a link for that. It's really important before the visit to ensure that your audio, video, and internet work, because those things are not always perfect. So you should have a little time to troubleshoot and then connect at the appointed time. Next slide. Thank you.
All right, thank you very much, Natalie. We are now going to pause and take some questions. I see a number of questions have come through. We have a lot of time for your questions. We're eager to answer all questions about your vascular health during the pandemic or in general. And we have just tremendous breadth of expertise with my colleagues here. Maybe I will start us off. Actually, a question for you, Dr. Evans. Can you address some questions have come in about the association of COVID-19 and blood clots, and maybe tell our participants a little bit about that. Do people need to be concerned they're going to get a blood clot even if they don't have severe symptoms? Tell us a little bit about that association.
Yeah, so such a great question. So first of all, anytime someone is critically ill, the risk of blood clotting increases because of inflammation and being immobilized and other factors. But interestingly, in particular, COVID-19 and severe COVID-19, so patients who are in the intensive care unit, seem to be at much higher risk for thrombosis or blood clotting. And probably that's partly inflammation, but also because COVID-19 appears to activate parts of the clotting cascade or parts of the clotting system. And so people who are taking care of COVID patients are looking very closely at how best to prevent blood clots and how to treat blood clots. I think your question about mild COVID infection, there probably is some association, but it's really the patients who are severely ill who are at highest risk of blood clots.
All right, thank you. And along those lines, for Dr. Evans or any of our panelists, I've heard there's a question that there seems to be some anecdotal association of COVID-19 and stroke or clots in the arteries. And is there any validity to this, and what does the experience show? Any of our panelists want to tackle that one?
So I let Dr. Kashyap answer this one. I think he's had some experience.
Natalie.
Yeah. Wonderful. Yeah, thank you for that question. Can you guys hear me?
Yes.
Okay, wonderful. Yeah, so I know we all get consumed by the 24/7 CNN, Fox News, and other channels, and I think they do portray some of the most dramatic patients. Yes, there's a huge concern about large vessel thrombosis, that is blood clots in the big vessels, in vessels that we rarely see a blood clot in, the aorta, the iliac artery. These are very large blood vessels that the only reason one would get a blood clot is really to have a severe condition that leads to abnormal blood clots, and also blood clots in the large vessels in the neck. That's very rare. And in fact, in the COVID experience, it also is still rare, but it's definitely higher than what we would have normally anticipated. So I agree with Dr. Evans, there's clearly a link between either the cytokine storm or something related to the actual COVID proteins that leads to thrombosis. There's some early evidence that it causes endothelial dysfunction, which can also lead to blood clots. We don't know all the answers there, but the folks that are getting the blood clots are not the folks that are mildly symptomatic or asymptomatic. They're the ones that are already critically ill, often in the hospitals. Yes, there have been a couple of reports of younger people getting strokes, but that's not been, I think we hear that and we think everybody's having that, but that's still a very small group of patients.
And Dr. Evans, you want to add on that and maybe address some of the strategies that are being employed to prevent blood clots?
Yeah, so most organizations, in our organization certainly, are looking at those highest risk patients and trying to determine what the best drug prevention strategy is. So many times patients who are in the hospital get low doses of blood thinners to prevent blood clots. And so our group here is looking at those high risk patients, and if they meet certain characteristics, doing much more aggressive prevention measures. And I think everybody is very mindful of this too. So there's a lot of awareness on the part of providers that this is a high risk clotting condition for those very seriously ill patients, and they're looking at it very carefully.
All right, I'm going to change gears a little bit, and a couple of questions related to the topic of COVID-19 and high blood pressure, and perhaps certain high blood pressure medications being of concern. I don't know, any of our panelists, Dr. Shishabor or Dr. Evans, want to tackle that one?
I am happy to answer that if you like.
Please.
Heather. There's been a number of studies, even in a short time. A lot of it has come from China and some of it from South Korea and other countries, that have shown that patients that have high blood pressure, those that have coronary artery disease and diabetes, if they get COVID, they are at higher risk of bad outcomes. Typically, what's been coded in the literature for those patients is that 2 to 3 times higher mortality compared to those that do not have those 3 conditions. I saw in the questions that somebody asked, what if your blood pressure is controlled? The studies that I have looked at so far, it doesn't really matter. It's not that high blood pressure per se. We think that genetically, maybe those patients that have high blood pressure, coronary artery disease, and diabetes, somehow, we still need to learn, are at higher risk of bad outcomes compared to those that do not have those conditions if they get COVID. However, that does not mean that if you have high blood pressure, you are more likely to get COVID. So it's a little bit different. I hope I explained it correctly. So for those reasons, we suggest that people that have high blood pressure, coronary artery disease, or have diabetes, if they have symptoms, to please seek help rapidly and not wait. Because if it is COVID, we want to know about it and we want to be able to help. And if it's not COVID, we don't want to let something that is brewing go undiagnosed and untreated. So for that reason, we are kind of want to bring that to the attention of our patients, that those 3 things are risk factors, amongst others. Obviously, if you have lung disease, if you are immunocompromised and other things, that puts you at higher risk with COVID infection.
And then I might just add very specifically, some patients have had questions about ACE inhibitors or angiotensin receptor blockers. And the American Heart Association and other organizations came out with a statement that really those medicines should be continued, that there does not seem to be a risk with continuing those medicines. I'm going to shift gears a little bit and have a question for Dr. Kashyap, more of a general question. This gentleman has coronary disease, had recent open heart surgery at UH, and has PAD and has had stenting in his right leg in the past, but walking is still difficult. The lower leg area becomes very sore. Other than surgery, would continuing walking improve the circulation and symptoms in the right leg?
Yeah, that's a great question, Dr. Gornick, and thank you for the participant that put in that question. Absolutely. So if a patient has claudication, which is pain in the legs that's usually very reproducible with walking, that gets better after rest, that is a condition where continued walking makes a lot of sense. In fact, we have some very good data that if a person is in an exercise program, and in fact, in normal times, we have a PAD exercise program, which is currently on hold. We found that many of those patients can walk 30 or 50% greater distances when they're supervised and kind of encouraged to walk further. Something simple I tell my patients is go to your neighborhood high school track, and hopefully the high school track is not locked. I know in some communities now they are locked, but if you can go to a track and keep a diary of how far you're walking. I've had some patients that can only go 50 meters or 75 meters. There are those markers on the track, and you can write that down, and then they keep on trying to go 10% further each time they go to the track, and I've had some patients get up to a quarter mile. So that's a good strategy to do now. Now, if the pain is there all the time, if there are color changes in the foot, if there's pain at nighttime that causes one to wake up, if there are ulcers, like Dr. Shishibor's slide showed you, areas of tissue that are lost because of ischemia, that is a critical problem. That requires that individual to contact his or her doctor immediately, have either a virtual visit or a real person visit if needed, to get addressed and treated right away.
Thank you. And Dr. Shishibor, kind of a similar question. This attendee had a heart attack in January, and unfortunately they could not open up the blockage, but there were a lot of collateral arteries, and it was suggested this person do cardiac rehab, but the cardiac rehabs have been closed, and was wondering what suggestions you would have for this person. They're trying to do a little bit on their own, and they're also wondering, when we open back up, is it too late to go back to cardiac rehab?
Thank you, Heather, and thank you for the question. No, I'm going to make it short. It's never a bad idea to get cardiac rehab. So please, as soon as they are open, and hopefully we can send you guys, at least since we have your information, kind of an email reminding you when those things are open. But yes, as soon as they are open, you should get your cardiac rehab. In the meantime, I think Dr. Kashyap gave some very nice advice. Please use the outdoors, and the weather is getting better, to get some exercise and some walking while you wait for the cardiac rehab and other facilities to open.
Okay, now I'm going to move us into the venous system. Okay, so in vascular, we've got arteries, veins, and lymphatics. We got some venous questions. So first question here, let's see, is for, let's say, Dr. Evans. I have swelling in my foot. Should I talk this over with my PCP? What should I do?
So that is, I think the answer is usually yes. If you've had swelling in your foot for many, many, many years, and this is usual for you, it may not be an urgency, but swelling is something that we deal with in vascular medicine all the time. And if it's something new and different, in fact, I use that as a guide for a lot of my patients when it comes to any symptom. If it's new, different, or progressive, you probably should get it checked out. And so I think this is definitely worth a phone call to your doctor's office to see what's going on here.
And along those lines, a question for Dr. Kashyap. Do we care for venous conditions at our institute? What do we have going on for venous disease?
Yes, absolutely. Great question. And venous disease is as complicated and as broad and as sometimes, let's say, as many varieties of problems as with arterial disease. So absolutely, we take care of patients all the way from, let's say, varicose veins, inflammation of the leg that requires perhaps compression hose and occasionally surgery, all the way to life-threatening blood clots, like the other question that was asked about arterial blood clots and stroke. Venous blood clots are still very prevalent, something that we treat often with medicines, but sometimes with either an intervention, with catheters, with a clot-busting agent. So yes, we're available. The critical problems, blood clots, pulmonary emboli, severe sudden swelling of the leg, severe sudden pain in the leg, or shortness of breath, those should be attended to immediately. And we are available, the emergency rooms are available. Please do not withhold or hold back seeking an answer and getting care. On the other hand, chronic problems, like Dr. Evans said, perhaps chronic leg swelling, chronic varicose veins that have been there for years and causing some pain. Once we get back to some normalcy, yes, those patients will be taken care of, and probably sooner rather than later, given the new May 1, that is tomorrow, opening up of outpatient surgery.
All right, thank you, Dr. Kashyap. Dr. Evans, I'm going to go back to you. A couple of rapid-fire venous questions. What medication can help with itching, dry skin with a blood clot? Take that one quickly.
The answer is it depends, but in general, you can do something that has an anti-itch component like Sarna lotion. Some people use some of the medications like Gold Bond for patients with diabetes. That can be very helpful. I think the important key is making sure you moisturize frequently. So anything that's thicker, a cream versus a lotion, will tend to be more effective. And then some people actually need steroid ointments or steroid creams.
And then another question for you, Dr. Evans. One of the participants notices that when she gets her menstrual periods, the vasculature of the legs and the veins, and others, please, I see you nodding, hop in on this as well. They have worsening symptoms during the menstrual cycle involving the varicose veins.
Yeah, so that's such a tough one. And I think, there are things we can do for that. Compression stocking, sometimes we can get rid of those varicose veins. It's definitely worth looking into, but many people will notice that symptoms are worse around the time of the menstrual cycle. A lot of women will have swelling. It's common. It's not necessarily dangerous, but it can have a real impact on your quality of life. And so I always tell people that's worth checking out.
All right, and Dr. Shishra, I'm going to go back to you. Can you explain the color changes? We're going to switch back to the arteries now. The color changes seen with gangrene progression. I guess what is gangrene? What should you see? What does it look like early on?
Yes. Well, typically what happens is that, usually what we say, at least this is a teaching point I try to always make to my fellows and residents and students. A lot of patients have vascular disease, but do not have gangrene. Classically, what happens is that there is a trauma, some kind of a trauma, wearing a new pair of shoes, and maybe getting your nails cut off, too aggressively, maybe banging your toes to the chair and you have diabetic neuropathy and you didn't feel it, maybe stepping on a nail. Something causes the barrier, this skin barrier, to be broken. When that happens, obviously you create an ulcer, or some degree of a tissue loss. Then over time, depending on how bad of a vascular disease you have, that can progress. So in the beginning, it may just look like there is some breakdown of the skin. You may see some tissue and some leakage from it. It may get infected, so it may be red. And then with time, if you have significant vascular disease, if you don't take care of that, it becomes it becomes more darker, and eventually may turn to black. When it gets to the black, it's kind of the end stage, is now forming gangrene. Now, it depends on how extensive that gangrene is. If it's just superficial dead tissue, we can take that off with medication or creams, or even with a scalpel. If it becomes extensive, let's say your whole toe or part of your foot is totally black and gangrenous, then unfortunately you end up losing those. And that's why it's so important, as Dr. Kashyap mentioned, is that we want to see you in the earliest stages. So if someone has a breakdown of the skin, they have diabetes, they have vascular disease, even if they don't, and they want to just make sure, that's the kind of the time we want to see folks to make sure we prevent things from getting to dark and black, because once there is blackness and gangrene, I think that kind of we say the horse that at the barn, and we unfortunately end up having a hard time getting the tissue back. So I hope I answered that question.
Thank you, Dr. Shishapur. Let me ask this question of Dr. Kashyap. I think it's a really good general question. What are we doing at UH and our vascular center to engage with the patients who may have disengaged and who are at home sheltering in place during COVID-19? How are we going to be connecting with our patients?
Well, this is a great example right here. So thank you, Dr. Gornick, Tiffany Hatcher, and others for putting this on. I think this is a wonderful way to communicate and connect with our community. But I think you're exactly right. I have a close personal friend who I was shocked to find out yesterday has not been out of the house since March 15th. And he's not very old. He's fairly healthy. You know, he and I play tennis together, and he is so afraid of even stepping out the door. Has not been out of the house, has had every grocery delivered, has not traveled anywhere. And I think you're exactly right. The questioner is exactly right. There are probably a lot of folks that are not only socially distancing, but socially isolating. And I think we have to redouble our efforts to let everybody know that we are available to help if there's a medical issue, and do not delay care. But I think the 100 folks or so that are on this webinar know that already. We've got to get this message out to the thousands of folks that are not on this webinar, which may be very hard to do. And hopefully at some point our discussion, and this is a little bit more of a global issue, but we've talked about treating COVID and preventing COVID-related mortality. But I think we also have to look at aggregate mortality. And Dr. Shishapur and Dr. Evans and I have talked before about people that are delaying care and dying of some other problem. And will we see a year from now that actually our COVID spike wasn't that high, but our cardiovascular spike was very high during this time? So please, those of you that are listening, get the message out. You know, do not delay care if there's a problem.
Hey, Heather, I'd like to also follow up on that.
Please, Mehdi.
Yeah, you know, so in addition to obviously doing these webinars, many of us have been very active in the community to try to get the message out to the folks. It's a little bit challenging, as Dr. Kashyap mentioned, because, for example, right now we are lucky enough to have the couple hundred of you that have joined and discussed these things with. Now imagine we're trying to get a hold of thousands of folks here in Northeast Ohio to get this message out. So I think the word of mouth is very important. What you guys can relay as ambassadors of this webinar and take this message to home, to your families, to your neighbors, that there are these issues that are going on, and that, you know, if patients need help, they should seek help. That's one. And two is that, you know, we are committed to our communities. I saw a question about our communities, and we are dedicated to our communities. We have tried to reach out through the media, through the newspaper, through other modalities to try to get the message out about the kind of things that Dr. Kashyap was talking about related to heart disease, vascular disease, and not staying at home and seeking help. But if you have ideas, maybe this person that asked the question has some ideas. If you do have ideas, also tell us, because maybe we're not thinking of it. So if you guys, the folks that are on this webinar, or some of your friends, if you have good ideas, please reach out to us and let us know, and we are more than happy to engage you in any way possible.
A couple related questions on COVID and masking. So some patients who have various vascular problems or high blood pressure, other risk factors, blood clots, and they're wondering, should they wear a mask in their work? Someone here works, I believe, in a dental practice, so is exposed to some aerosolized aerosol exposure. So questions about masking, and any comments from the panel on masking in the work setting?
I think it's important that we all, for now, until we have a better handle on testing and a better handle on the pandemic, that we all try to mask. So, you know, my mom sent me a dozen homemade masks, and I use those when I go to the grocery store. And I think there you go. Dr. Kashef's got his mask on right now. And I think it really, it helps protect others. It may help protect you. And, you know, if you can give yourself a little bit of an advantage, do it. It's a pretty low, it's what we call a low risk intervention.
And I see some people are saying here the masks are comment that they have discomfort with the mask. And I might just say there's different kinds of masks. There's various types of cloth masks, more of the medical masks, obviously the N95s, which are more for people involved in medical procedures, but there are many different types of masks. Dr. Kashep or Shishabor, any additional comments on masking or what we're doing at UH with regard to masking? Will people see their doctor's mask?
Yeah. So this is a challenging question, and I'll raise my hand and say I'm not a mask expert. And just like all of you, probably in the last month, we've all had times when we're very confused by the guidance that we get both nationally and regionally. So many of you will remember a month ago, no, don't wear a mask, it doesn't help. And then we've got to pivot based on some data from Europe, based on some data from South Korea. You know, it is a bit challenging because we get one instruction or message and it changes. I think one thing that's important is masking, as Dr. Evans alluded to, is probably helping prevent us from giving the virus to someone else if we're an asymptomatic carrier. I think the confusion occurs that many people think wearing a mask may prevent them from getting COVID. That data is much less clear. And unless you're wearing it, I just looked at an article today, in fact, where there are some healthcare workers that are taking care of COVID-19 patients without an N95 mask. And to me, that's a bit shocking. But now they're showing data that those healthcare workers are definitely at a higher risk for getting coronavirus. So I think it makes sense. It's a simple intervention. We'll probably know much more in 6 months whether or not the cloth masks, the homemade masks are as effective as something with 2 layers. We don't know that yet.
I can share a quick story, Heather, if that's okay.
Please, absolutely.
You may see that these blisters on top of my nose, the bridge of my nose, the folks that are on the webinar, this is from a mask that I was wearing yesterday. So I do want to emphasize that if you come to the hospital or to the clinic, at least at UH, it is mandatory to wear a mask. We think that it is important. It is not only to protect you, it's also to protect other patients that are around you, and it's also important to protect the healthcare workers. And the healthcare workers should also have a mask. Every one of us have been told to wear a mask. So it is, and I think that that's probably good advice. I've taken it very seriously as evidence. So I hope that if you come to your appointments, or if you are coming for a procedure, you bring your own mask and come to the appointments and your testing and your procedure with a mask from home. Don't come without a mask. And if you have family members that are coming with you, they should be wearing a mask too.
Outstanding, thank you. Last comment, Vic?
Yeah, thank you, Heather. So one other comment is we live in fast changing times. So just as of yesterday, we at UH will start testing patients that are coming for elective surgery for COVID-19. So that's an additional change. that patients can feel at least comfortable that they won't undergo a procedure and perhaps be an asymptomatic carrier, because we do know that some patients that get anesthesia and have COVID-19 have worse outcomes. So that's a recent change, and I think we'll have more to come, hopefully as our testing capacity continues to improve and increase. We'll be testing more patients, and quite frankly, most of us.
All right, we have about 3 minutes left, and we're going to do some rapid fire questions with our panel here. I might take a couple questions on fibromuscular dysplasia and FMD, which is my clinical passion. We don't know of any direct association, and I have not, thankfully, had patients who've become severely ill. I think like all of these conditions, any chronic health conditions potentially increases the risk of having a more severe course. But that being said, I don't think there's anything specific to fibromuscular dysplasia. Dr. Evans, what is phlebitis, and is this dangerous?
Yeah, so phlebitis is kind of a generic term for clotting. When I think of phlebitis, I think of superficial phlebitis, which is less dangerous. Deep vein phlebitis can be dangerous. That's deep vein thrombosis. And so people with that condition typically have more aggressive care.
Okay, Dr. Shishaborn-Kashyap, a few sentences each about the very important association of smoking and vascular health.
Definitely for atherosclerosis, which is the hardening of the arteries in almost all blood vessels, smoking has a very high association. And also importantly, it has a high association with patients that develop aneurysms. So if you don't smoke, don't start. If you do smoke, please stop.
Perfect. And
also, just a note there, Dr. Gornick, patients who smoke tend to have worse outcomes with COVID-19 too.
Okay. Important point. So now more than ever may be a good time to work on quitting.
Absolutely.
Dr. Shishaborn, can you quickly, this may not be a 1-minute question, but is there a link between the heart and kidneys, and can heart meds affect the kidneys?
Absolutely. The body is connected. So if you do something to one part, it's definitely somehow or the other is going to affect others. We know there is a brain-heart connection. We know there is a kidney-heart connection. Obviously, the two work very well together in controlling blood pressure, the blood pressure issues, the fluid issues. So yes, and some of the medications we take for the heart could affect the kidneys. Some of the things we take for blood pressure could affect the kidneys. So that's a general, obviously, answer. But the answer to that is yes, 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 there is connection.
And then last question to Dr. Evans. Someone's asking if we do drive-through testing for Coumadin. And I guess maybe just as a second question, are our Coumadin clinics open?
So the answer to the second question is Coumadin clinics are absolutely open. Some of them, I actually learned this today, some of them are doing some drive-up testing, but I don't think that is routine. I actually don't know. You'll have to ask your Coumadin clinic.
All right. That will wrap it up for our questions and answers. I'm just going to conclude here with a little bit more information. Shown here are some resources and follow-up of some of the things we've talked about today. The University Hospitals has a rich coronavirus information website. The American Heart Association has a specific page on COVID-19. CDC is a great source of information, and the Ohio Department of Health. And also here we have a resource, our Connors Integrative Health Network has some wonderful resources for stress reduction, which I think we could all use these days, including some guided meditations you may want to look into. We have a series of upcoming webinars here, including one on coronary and peripheral disease that will be tomorrow, managing heart failure during COVID and atrial fibrillation during COVID. So I want to thank my colleagues and friends for their time in sharing this information and answering your questions. This was a lot of fun. Maybe we should do this again sometime. A couple of reminders for our participants. We're going to email a link to view this session on our website. If you'd like to schedule an appointment with any of our wonderful presenters today or any University Hospital's heart or vascular specialists, please call 216-465-7893. This concludes today's webinar. Thank you for attending, and we hope you I hope you join us for other webinars in the future. And again, thank you to my colleagues for a really enjoyable and informative hour.
Thank you so much.
Bye. Thank you.
Nice weekend.